In today's Eye on Health, February is Heart Month, a time to zero in on our cardiac care. But imagine being a pregnant woman with a heart condition, and what do you do to keep yourself and your baby safe? Joining us today, Director of AHN's Women's Heart Center cardiologist Indu Poormina and Emily Mick, a patient who was under Dr. Poormina's care while pregnant. Thank you both for being here with us.
Thank you.
And Emily, I want to really start with you because, you know, it's hard enough to be pregnant. So talk to us about your very healthy,
Yes.
Is it 16-month-old, 17-month-old
Yes.
baby girl? What was that like to have to go through this process, and what was your condition?
I have hypertrophic cardiomyopathy, and I also have a sub-Q defibrillator. So there was a lot of hesitation for myself and my family before I got pregnant. And Dr. Poormina kind of helped me work through the plan and said that, you know, it's okay. I think you're healthy enough to go ahead and move forward. So that was definitely super helpful to even get the process started.
So Dr. Poormina, talk to us about the care that women could already receive while pregnant, but really creating this center so there's a designated place to receive this.
Yeah, absolutely. First of all, thank you for highlighting this issue, which I think is very relevant because maternal mortality in the United States is the highest among the developed countries.
Wow.
In addition, cardiovascular disease is the #1 cause of maternal mortality. So we do think that this is a problem that deserves attention and requires focused attention. In addition, women who may be at risk for cardiovascular disease but don't yet have manifestations of it are women also who are served by this clinic. And that's really the thought process behind it, in having a concerted center right next to the obstetrician's office, which makes it easier for patients to navigate both.
I thought this was interesting too, in reading some of the notes about this, that preeclampsia has increased as well. I know, so I went through that with my first and then was borderline with my third, but in talking with other women, I was really surprised to hear how many other moms had gone through something like this.
Absolutely. So preeclampsia is basically high blood pressure during pregnancy, and especially when it's associated with protein in the urine or with any other form of organ dysfunction, it has significant implications on future cardiovascular health, but also on immediate maternal health. And yes, the rates of preeclampsia are on the rise in the United States. We think it's probably related to older maternal age, but also due to some of the other risk factors that women already come in with for pregnancy, which is obesity, high blood pressure, diabetes, things like that. So yeah, that is definitely something we need to talk about as well.
What I think is really interesting is that you were able to work on your plan before getting pregnant, during your pregnancy. Did you also have enough care after pregnancy then with this center?
Yes, absolutely. Yeah, I was monitored very closely throughout the whole thing and afterwards. So that definitely took a lot of stress off of the entire situation for me.
And Dr. Poormina, who can seek help with this center? Is this something that you should talk with your doctor about if you have any concerns?
Absolutely. So women can definitely talk to the obstetricians, gynecologists. So the women who are contemplating conception, such as Emily, who have a history of cardiovascular disease, really should be talking to their gynecologist about consulting with a cardiologist prior to becoming pregnant. But also the obstetricians, once they get pregnant, we also are obviously educating the obstetrics community and making referrals to us so that we can collaborate in the patient's care.
Thank you both for coming on. I do think, as you mentioned, very important topic and relevant given what we're seeing in trends across the country.
Yes.
Thank you. And so happy to hear about your baby girl.
Oh, thank you.
So wonderful.
She's amazing.
I'm sure she is. For more information on the AHN Cardio Obstetrics Clinic, you can go to our website, pittsburghtodaylive.com. And remember to keep watching for our Eye on Health series right here on PCL. It happens on Wednesdays, and it's brought to you by Highmark Blue Cross Blue Shield, together with Allegheny Health Network, for your health.